According to Indeed.com, job postings for remote nursing jobs on Indeed have risen 392% since March of 2020. At the same time, there are more people competing for these jobs as nurses become more aware of the options available. In today's episode, we're going to look at common remote nursing positions, including average salary, how to find these positions, and resume and interview tips to help you land the position. Welcome to the Stay at Home Nurse Podcast. I'm your host, Deanna Cooper Gillingham. For over 25 years, I've strived to use my nurse credentials to find work that fit my lifestyle, whether it was raising my 4 children and 3 fur babies, traveling the world, or moving to Mexico and living on the Caribbean Sea. Sometimes I succeeded, and sometimes I failed, but I always learned from the experience. Now, I want to help you by sharing what worked and what didn't work. There are so many opportunities out there for nurses today. The Stay at Home Nurse Podcast will inspire and equip you to have a nursing career that is meaningful and supports your lifestyle. Now let's get started. Indeed.com announced that postings for remote nursing jobs increased by 392% since March. But the search for these positions also increased by 1,000%. Let's start by taking a look at a few of the common nursing positions that are posted. First, there's triage registered nurse. The national average salary listed on Indeed is $63,000. These nurses are hired by clinics and hospitals to work remotely as part of their triage team. They assess the patient over the phone to determine the severity of the symptoms and whether they need to go to a hospital, can be treated at home, or should go to a doctor's office or ER. They also need to be able to answer simple questions that the callers have and advise the patient of treatments that they can do from home if appropriate. If the patient needs to see a doctor, these professionals may coordinate appointments for the patients to visit the clinic. If the problem is urgent, then telemedicine nurses need to arrange the resources that the patient needs, such as an ambulance or an at-home visit from a doctor. A remote triage nurse must ensure that the right resources are available to the patient and that time is used as efficiently as possible for all members of the medical team. Another common job posted on Indeed is a registered nurse case manager. Indeed lists the national salary average for this position as $72,700. A case manager is responsible for coordinating all aspects of their patient's care and allocate resources that ensure that the patient receives the best care possible. They are responsible for making sure that each care plan they create and implement meets the physical and health needs of the patient, as well as their emotional and social needs. Typically, the type of patients these nurse case managers manage are people who are recovering from serious illnesses or injuries, or those who have a chronic disease. Case management nurses could work in the community or as part of a large hospital or clinic. They work closely with doctors, social workers, and other healthcare staff. I've dedicated an entire episode to case management. You can find this in episode 35, Work from Home Nursing Job Series, Case Management. We'll have a link in the show notes. Also, don't forget, I have a Foundations of Case Management course. If you would like to transition from the bedside to case management, this course is for you. You can find more information on our website, casemanagementinstitute.com, and again, we'll have a link in the show notes. The next position we're going to talk about is online nurse educator. Indeed.com lists the national average salary for this position as $85,500. The online nurse educator role involves strategic planning and implementing of educational courses and the methods used to evaluate these courses. These professionals can work in a hospital providing on-the-job training for new staff or as part of professional development. A training provider, company, or college that offers online educational courses could also employ you. Another remote nursing position is a medical coder. Indeed lists the national average salary for this position as $23 an hour. This has not always traditionally been a role done by a nurse, but many companies are finding that nurses have the clinical background to be excellent at this job. Specifically, a nursing background can help understand the complex role because they will be interpreting patient notes and medical records. Hospitals and clinics provide patients with a range of services such as laboratory tests, scans, radiographs, treatments, and consults. Medical coders, who may also be called medical billers, are employed to read, interpret, and analyze the patient's records and charts to see what treatments the physician gave and following their diagnosis. These professionals will then translate this information into a series of industry-standard codes that medical insurance companies and healthcare providers can use in their billing process. Additional duties could include providing education on federal compliance, performing audits, administrations of claims that have been denied, and helping to assist patients with appeals and issues in insurance coverage. Medical coders act as a link between the patient, the healthcare team, and the insurance company. They communicate with these groups to ensure that the codes are accurate and the correct diagnosis is identified. We've identified a wide variety of nursing jobs that can be done remotely. Now, how do you find these nursing jobs? Well, of course, Indeed recommends that you use their platform, but it can be a little bit hard to find a remote job on Indeed. There are just so many listings, and every company can list their teleworking or remote positions a little different. That being said, you're going to want to make a combination of remote, telework, or other words similar, such as virtual, online, teletherapy, telehealth, telemedicine, and registered nurse, LPN, or position such as case manager, utilization review, coder, educator, nurse practitioner, etc. Looking for these positions can actually be a little bit tricky, but refer back to our episode number 28, Everything Remote Nursing, with the remote nurse Sadie Gleason, and there you will find a lot of tips that Sadie gives. She's actually dedicated a whole website and a whole Facebook group to helping people find remote nursing jobs. She also has courses, and she has a special insiders group that gets early access to remote nursing job postings. We'll have a link again in the show notes. One of the things that I love about Sadie going through these for us is she knows all the terms that are commonly used, as well as some of the more obscure companies that we may not notice. Okay, moving on. Now that you've found some positions that you'd like to apply for, you need a resume. Resumes for remote positions are a little bit different than you would have a resume for a hospital position. You really want to highlight any previous remote working that you've done. Now, thinking about it, you may think that you've never worked remotely, but have you ever had to call patients from the hospital or from a clinic or a doctor's office? I know I did. When I worked at a GI lab, one of our roles was at the end of the day, we took about an hour and we called all the patients that we saw the previous day, checking in on them, making sure they were doing okay, seeing if they had any complications or any problems, and answering any questions that they had. This was a telework position. Even though it was only for 1 hour, and even though I did it from the hospital, I was calling patients at their home, interacting with them, and I was assessing them. I was triaging them if they did have any problems, and I was directing them as to what they needed to do to follow up. We also did this when I worked on the OB unit. We would take calls from patients that maybe thought that they might be in preterm labor, or maybe they fell at home, and again, we would triage them and give them instructions on what to do. Also highlight any computer work that you do. If you spend a long time on the computer, maybe gathering some information for quality, you need to put that on your resume. You also want to highlight all the different experience that you have. A lot of these positions want nurses with a variety of experience and not necessarily somebody who's been at the exact same position for 20 years. Okay, those of you that have worked for 20 years, you need to cut down the resume. Nobody wants to read 3 pages of what you've done. One of my suggestions is at the top of your resume, just have some bullet points of the different areas you've worked, such as oncology, ER, OB. These bullet points let a prospective employee know at a glance all the different things that you've done, so that they'll continue to read the rest of your resume where you can expound on it. Now, if you truly have no experience working remotely, emphasize your technical experience, your computer experience, your strong communication skills, patient education, and your ability to learn, especially your ability to learn independently, as you will be working independently if you're working from your own home. You will also want to demonstrate a different set of skills than you would working at the bedside. Nobody cares if you can put an IV in or a Foley in with your eyes closed when you're working from home. They do want to know that you've been able to work on the EMRs and what EMRs you've been working on, that you're competent and comfortable using things like email, Microsoft Office, Google Docs, or other web and computer-based platforms. Okay, hopefully your resume was a hit and you got an interview. As you prepare for your interview for a remote nursing role, keep in mind that the interview serves as a demonstration of how you will potentially interact with patients. You will also be showing your adaptness to using the telephone and video technologies, so you really need to prepare ahead of time. If you've never used the online platform, you may want to practice using Zoom or something else just so that you know what you're doing and you don't fumble around. This would not look good if you're going to be using this platform in your job if you can't figure out how to do it for the interview. Another tip, if you're doing a video interview, is to do it in the place where you'll be working, in your home office. This way, the interviewer can get an idea of what your home office setup is like and an idea of how you work. Make sure that it's clutter-free, has good lighting, and that there's a nice background. In fact, if you have some degrees and certifications, you might want to add those to your background. And most importantly, make sure there are no distractions. Close any windows, tabs, or applications on your computer that may be distracting. Also, make sure that nobody's going to be walking into that room, calling you. Make sure your phone's on silent. Again, they're going to be looking at how you would look to a potential patient or colleague that you're interacting with. Interview questions that may be specific to remote nursing jobs include things like, how comfortable are you using technology? What do you do when your technology fails? Share an example of when you had to troubleshoot technology in your current work environment, along with questions about your ability to work remotely, especially if you've never done so previously. One last thing that I want to leave you with. It's important to emphasize your passion for the company over your desire to work remotely. When they ask why you want to work there, don't say, well, because you offer remote positions. You need to make sure you've researched the company beforehand and that you have a real reason for wanting to work there other than they offer remote positions. In an interview, the overarching message you should be giving is that you are interested in that specific role at their company, not your desire to work remotely. Employers are looking for individuals who will be the best fit for them and want to know that your main driver for applying is the position itself, not the fact that it happens to be remote. If you overemphasize the desire to work remotely, you'll be communicating that your main reason for selecting this position is remoteness and not necessarily the job itself. Okay, that's a wrap for this week's episode. I want to thank you for listening and helping us to reach 10,000 downloads in just a few months. I also want to thank all of you who took the time to rate and review the podcast. We have 46 5-star ratings. How exciting is that? If you've enjoyed this podcast, I hope you will consider sharing it with a friend or colleague who would benefit from hearing it. If there's a topic you'd like me to cover in a future episode, or if you have any comments, please send me an email. hello@thestayathome.nurse.com.